Hello, this is Dr. David Greene, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is the basics of the kyphoplasty procedure for vertebral compression fractures. Over 700,000 compression fractures now occur every year, and a lot of these are due to osteoporosis, and a significant amount actually go unnoticed because they don't cause any pain. 50% of women and a fourth of men will have an osteoporotic fracture in their lifetime, and once a compression fracture occurs, there is a five-fold increased incidence of having another one. The symptoms of a compression fracture may include sudden onset of back pain that gets worse when standing or walking, limited spinal mobility because of the pain, and you may see some height loss, deformity, and disability, difficulty with activities due to the pain. Now, this is called the downward spiral of compression fractures. You have a spinal fracture, leads to back pain and deformity, and you can have multiple fractures that then cause more and more forward deformity. It can compress on the lungs, cause impaired function, lose appetite because it compresses on the stomach. It can cause difficulty with sleeping because of the pain, less activity, which leads to more bone loss and more fractures, and then all these together lead to a 23% increase in mortality. Treatment options traditionally have included such things as benign neglect, which is basically where you just watch it. And it may be that the pain is not bad enough to really need narcotics or bracing, so you just kind of watch it, and if the pain gets worse, then you can jump into medications, and this may just be over-the-counter medications like nonsteroidal anti-inflammatories and Tylenol. Narcotics can help a lot with pain relief. You have to be careful because they do have side effects such as constipation. There's a risk of addiction, intolerance. Muscle relaxers can help because these fractures often lead to spasms. Spinal bracing, such as you see here, this is called a Jewett brace, and it gives three areas of support: lower, upper, and then in the back, and it can help a person stand up straight and stabilize, the spine. There's also a TLSO, which is basically coverage all the way in the front and the back. That's a little bit more cumbersome, especially in warmer climates. Now, the vertebroplasty procedure was invented in the 1980s for treatment of fractures due to cancer, and eventually it began usage in the 1990s for regular osteoporotic fractures. It's an outpatient, low-risk procedure that provides instant pain relief. This is a precursor to the kyphoplasty. The doctor will put a catheter into the fractured bone and then insert bone cement. This is the spinal canal here, so you avoid that by going through this bone called the pedicle. And doctors would either go through one side or potentially through both sides. Now, kyphoplasty is an evolution of the vertebroplasty procedure. It's not a revolution, it's an evolution, because it basically uses a lot of the same procedure, but then we'll show you the differences here. You actually insert a balloon and create a bony void, and then you insert the cement. It was FDA cleared back in 1998, and within 5 years the popularity increased tremendously because it works so well. Here's the steps in the procedure. Here's the fractured bone from the side. You can see the loss of height here. The tool is inserted here through this bone called the pedicle that we talked about. Okay, and then saline is used to inflate this balloon, and it pushes bone fragments up, forward, down, and this has a barium in it, so you can actually see as the balloon is inflated. And then you take the balloon out, you have this bony void here, and you slowly insert this bone cement, and then the procedure is complete. The bone cement heals within about 20 minutes. The outcomes: it causes immediate pain relief from the stabilization in over 90% of patients. The aches and the spasms, those may continue for a few weeks, but typically those resolve as well. Multiple studies in Lancet and dozens of others have shown that patients get increased function, better ability to do their activities of daily living and walk, in over 90% of the time. There have been a couple studies showing questionable benefit, and they are far outnumbered by the ones showing incredible pain relief. The Nevada Pain Network provides the best pain management doctors throughout the Las Vegas greater area and the surrounding areas of Henderson, Summerlin, Enterprise. They're award-winning and board-certified. There are several clinic locations accepting over 50 insurances and offering over 50 treatments, including medical and interventional pain management, chiropractic treatment, spinal decompression therapy, acupuncture, physical therapy. The number to call for treatment is 702-323-0553. And visit us on the web at nevadapainnetwork.com. I'm Dr. David Greene with the Nevada Pain Network. Your pain stops.